and welcome everybody to the CMS hospital requirements on anesthesia. This happens to be one of my favorite webinars, as a matter of fact. On slide number 3, I have also written the book on cracking the code on understanding the hospital COP standards on anesthesia. And this program is what we call a deep dive series, where we take a section out of the COP hospital manual and we go into detail by showing you and explaining what it means, giving you examples on how to comply. Because we don't want you to get one of these. This is a bad thing to get in the mail. This is a statement of deficiency, and then that means you didn't get it right, and now you need to do a plan of correction to fix it. So hopefully, by going through this, we will help you prevent any hospitals from getting cited. So let's jump in and talk about an introduction. So what we're telling you is current as of today, May the 22nd of 2020. And one of the questions that I always get is, hey, how do I keep up with changes in the future? So first of all, if you could maybe have 1 or 2 people in your hospital that sign up to get the Federal Register, and then when there are new regulations, they will come to your computer. It's free now. We used to have to pay a lot of money for it. Have someone once a month or 2 people who can go out once a month and check to see if there's a new manual, to check to see if there are any survey memos. Now, generally, I mentioned, I think if you go out and do the survey memos and check them once a month, you're probably okay. However, since we're still amidst the COVID-19 pandemic, you will notice that there's about 10 survey memos on this. So during this time, we suggest that you maybe go out every couple of days and take a look at it. And if there is a new manual that is promulgated, then what I do is I go back and they'll publish a transmittal on the same day. And the reason why I want to look at the transmittal is it will tell me not only it's a red line copy to show you the changes, but it will also show you what has been deleted, if they've deleted a tag number, again, a new tag number, or revised a tag number, and that's kind of important to, to help keep up with the changes. The most current manual that we have is February the 21st of 2020. However, as I mentioned, today is May 22nd of 2020. We do know that there will be another manual coming out, because they have 600 pages of regulations, and they had 201 pages on discharge planning, and another 393 on the Hospital Improvement Act, which has changes to nursing, medical records, access to records, H&Ps, all of that. And both of those, the regulation became effective November the 29th of 2019, but the interpretive guidelines and survey procedures will be out in 2020. And so CMS said it would be either late spring or early summer. So it's already, as I mentioned, May 22nd of 2020. We thought we would probably see them, anytime now, between now and maybe June. However, I wouldn't be surprised if they were delayed because everything has kind of been put on the back burner during the COVID-19 pandemic to give us opportunities to focus our attentions on taking care of patients. On slide number 7, this is how you subscribe. You just go to the website, put your email in, and hit submit. It's that easy. And then this is the website. Now, please note this is a new website. I have no idea why they felt the need to change the website, but this is where you now get all of the manuals. And whenever you go out to this website, you want to save this as a favorite. It will always take you to the most current manual. And we'll talk about the anesthesia requirements for critical access hospitals and the new tag number for those. In most of the instances in the last 4 or 5 years, every time they have made a change, it has been to bring these into being the same or shortened version. The anesthesia requirements are an exception to the rule. They are different. So please note that. So I will go over the 2 tag numbers in the Critical Access Hospital Manual, and that manual was also updated on February the 21st of 2020. And then I mentioned that there are 2 email addresses that you can email any questions to CMS. That first one is a new one that they came out with about 6 weeks ago. But again, both of these will work. So you want to save that, and I probably used this 40 or 50 times. It is just fabulous to be able to do that. And then this is the website for the survey memos. And I'm not quite sure why they do this, but when you go out, there's a middle column called posting date, and you need to double-click posting date. And then up it will, and then you just click on the one that you want, and this is a little bigger version. You can see that all the most recent ones have all been related to COVID-19 changes, 2 of them regarding EMTALA, 2 of them regarding prioritizing survey activities, so they're not going to have any of the 4 accreditation organizations survey during the pandemic to give us time to focus on COVID-19. And also they have 40 pages of 1135 waivers. For example, one of the important ones is today we're going to talk about CRNAs, and except in 17 states, they need to be supervised by the surgeon or by an anesthesiologist. That is one of the 1135 waivers. The reason why we call them 1135 waivers is they waive Section 1135 of the Social Security Administration Act. But for now, CRNAs during this COVID-19 pandemic do not have to be supervised by anyone in any state with the waiver. And I do know that the American Association of Nurse Anesthetists has asked CMS to make that permanent, and of course they haven't ruled on that issue. But for now, there are, and they do update the waivers all the time. There's all kinds of waivers related to there. On slide 11, this is an important slide. Again, there's your 2 email addresses. There is the website, the new website, which will get you all of the manuals. So first we'll talk about Appendix A, the hospital manual, and then we'll talk about Appendix W, which is the critical access hospital one. And if you don't know what a critical access hospital is, under Appendix W, they're 25 beds or less, although they can have a 10-bed rehab unit or a 10-bed behavioral health unit. But if they do, they're governed under Appendix A. I know that's confusing. It's just how they do it. But they're usually 35 miles away from the next closest hospital unless there's mountainous terrain or secondary roads. And actually there's about 1,368 critical access hospitals in this country. So first, we're going to talk about how safe injection practices is an important part to CMS, and they will observe the CRNAs or the anesthesiologists in the OR. In fact, there has been a number of deficiencies received, and I am going to show you the deficiency reports. Interestingly enough, they will cite them under infection control, so they're not necessarily picked up. When we show you the anesthesia ones, there's 135 deficiencies since CMS started doing a report, which are not, which is really not a bad number at all, except that some of the practices, they would cite them in another, for example, in infection control. And there were a lot of infection control and antibiotic stewardship program requirements that were in the hospital improvement rule. In fact, for example, for critical access hospitals, they have 25 new tag numbers for infection control and prevention and antibiotic stewardship program. But anyway, CMS has this infection control worksheet, and we have 3 of them. We have one on QAPI, one on discharge planning, and one on infection control. Interestingly enough, these are all 3 of the sections where there were multiple changes in the new hospital improvement rule and discharge planning. Right now, we've been using the same one since they came out, so we've been using them for about 6 years now. They came out in November of 2014. And they did publish some proposed changes to infection control. And what was nice is those were after the proposed changes were put out. So they did tend to mirror, and they did adopt almost everything they proposed in there. So the draft infection control worksheet again, has not been finalized. I did talk to Marion Palowich at CMS, who's in charge of the worksheets, and she mentioned that after those final interpretive guidelines and survey procedures come out, they will go ahead and tinker with those. And again, there were lots of changes to infection control.